Thanks for staying with us on Channels Television. Welcome to Health Matters. I'm Yomi Otaigbe. Losing someone or something you care about can be very painful, with different people experiencing difficult emotions. While there's no right or wrong way to grieve, there are healthy ways to coping with the pain, and that's what we'll be talking about today on the program. To help us deal with this topic, I have with me in the studio a consultant psychiatrist and clinical psychologist at the Federal Neuropsychiatric Hospital, Yaba, Lagos, Dr. Richard Adebayo. Thank you for joining us on the program.
Thank you. Good afternoon.
Yes, talking about grief, loss, and things, in that nature, what really can we classify as grief?
Okay, when we use the word grief, there are other terminologies that can be used, like mourning, bereavement. Well, these are psychological response, or let me say the behavioral response, that an individual would portray when one has lost someone, or the life of an individual is threatened, whether actual or real. So those responses, behavioral symptoms, sometimes even physical symptoms that accompany such reaction. Grieving is a normal response to loss, but at a stage it may become abnormal. So those behavioral patterns that an individual would show when one has lost someone dear to him, or one is passing through a very traumatic experience. These factors, these situations are referred to as the mourning or grief process. Okay,
so what are some of the behavioral patterns that you mentioned, and the physical aspect of it?
Okay, the physical aspects, where sometimes it may be obvious to people that people are involved in accidents or plane crash. You see some people with wounds, injuries, bleeding. We are not talking about those who have died, of course. Those who have died, but the people, the survivors, so to say, or even sometimes the first responders, those who will see those gory pictures and all that. You see the physical symptoms of people being agitated, crying and all that. But the psychological aspect, usually, this follows what we call the process, the grief process or loss. An individual, first of all, may show expression of shock. The individual is surprised, okay? Sometimes it can even be of, denial or disbelief or confusion, okay? You may get to a stage, the individual may express, feelings of, irritability or anger. Why should this thing happen? Why should it happen to me? Okay? And then another process of it, although it depends on some individuals, may follow in quick succession. But sometimes in some individuals, it may take some time before one move from one phase to another phase. For some people, irritability, I've mentioned the first one, anger, unbelief, shock, confusion. Then get to a stage, some people may be expressing guilt feelings. Maybe I should have stopped him from buying the ticket of that airline.
Okay, like in the case of
the case of a recent plane crash, or maybe I shouldn't have allowed him to go out that night. It can be in different formations, different perspectives like that. So guilt feelings may also follow. Then you get to a stage, the individual may now want to accept the fate. But for some other people, it's not just the issue of acceptance. They may still have some other phases in between, like depression. The person may become depressed, detached from environment, detached from people, withdrawn to self. If that is not taken care of at that stage, then the real depression, hopelessness, worthlessness may set in. For some people, after a few weeks, they're able to cope again and bounce back to their normal life. But for some people, it may continue. For some people, they may not express their grief immediately. It's like they are still in a state of shock. They're expressionless. They decide to just keep to themselves. You'll be wondering, but it's not even shouting, it's not even making noise, it's not even crying. Okay? So we have what we call delayed grief. Some people delayed their grief. Okay? they don't maintain that stoic expression for so long. After a while, then they begin to express some of these things I've mentioned earlier. You know, the shock, disbelief, anger, guilt feelings, you know, before it gets to the level of acceptance. That's like the final phase.
Oh, okay.
So we should be very careful. When someone has experienced a loss, but is not even expressing it, no emotional expression, we should not just feel that, oh, there's no problem.
Strong-hearted.
It's strong-hearted. There's that tendency that the person is experiencing a delayed grief. And with time, the real process will come up. And it may be difficult for that person to navigate through.
Okay. Now, let's narrow it down to what just happened recently, the Dana Air crash. The family members, the relatives, the friends of some of the victims right now are going through, you know, difficult times.
Process.
And what kind of help do they need now?
Okay. Well, what's happening now, we should expect that if someone has lost someone, should undergo the grief process. Okay. The person will feel the loss. So we expect that those physical symptoms and the psychological symptoms, of course, will be there. Let me still mention part of the physical symptoms. You may see such individual, they find it difficult now to sleep problems. Okay. These are some of the symptoms that may crop up. Some of them, they are still in shock. Some, they are agitated. Some, they have what we call the fight and flight syndrome. So the heart beats raises up, what we call palpitation. The heart begins to, you know, some of them have, you know, the intrusion of those things that happened. So they are worried in one way or the other. So they may have some what we call somatic or physical symptoms like headache, like pains, muscle tension, and all that, in addition to those behavioral symptoms I talked about. So what we need now is for those who are passing through such.
Okay, like there's this help desk and counseling center at the Lagos State University Teaching Hospital. Although, of course, there are issues that, okay, there are no counselors, but this is, you know, actually a step in the right direction, right?
Definitely. But what I'm just trying to say is that initially, you know, they are expressing their feelings, their symptoms. We should allow that. Because that tendency is that, oh, don't cry again, oh, no, don't take it easy. Yes, the person can take it easy, but we should allow them to express their feelings, ventilate their mind, ventilate their emotions, or of course within the normal context, not that the person wants to kill himself and then we allow the person to go and die. No, but that normal emotional expression, where to a large extent we should expect that person. So we should not say that, oh, don't cry, don't cry. No. Express your feelings.
What would be the implication of, you know, preventing such a person to express?
The emotions are bottled up. The emotions are bottled up, and then they may pass through, they may find it difficult to adjust. Okay? So they may develop adjustment disorders. Okay? They may have problems because the emotions are bottled up, their feelings are so bottled up. Then the tendency for some of them to feel so bad and then to go fast to the area of anxiety, depression, phobia, and if care is not taken, suicide. So they should express their emotions, but the loved ones, the family members should rally around, help them, okay? Say, comforting words to them, okay? Stand by them at such trying moments, okay? That's at the level of the individuals and families, the friends, the religious, you know, members, maybe church members or, you know, people from the mosque. They should also rally around, use the word of God to buffer them up, to help them to still have their belief system okay, to still feel that, well, tomorrow will still be okay, not this feeling of hopelessness and being dejected. So they need the people around them, the neighbors, the church members, okay, or religious members, the club members. So people need to pay them visits, rally around them, help them to see that tomorrow will still be okay. Then at the level of governments, yes, the counseling centers you talked about, yes, whereby we have not just the NEMA people, not just those who take care of their physical needs, but even these emotional needs, okay? Clinical psychologists should be there to counsel people, to help them to undergo this process. We call it the intervention, crisis intervention techniques, okay? They will be there to help such people, for them to quickly, as much as possible, come back to their normal selves again. But unfortunately, in this part of the world, where we lay emphasis on the the physical complications of trauma. Okay, so we rush them to emergency units in the hospitals, into ICU, and then we feel that once their wounds are taken care of or the bruises are taken care of, so they are free to go. Or sometimes move them to rehabilitation centers where they are given mattresses and what have you, food and all that. But we tend to forget the psychological implications. And the best time to start this is as soon as possible. As soon after the trauma, the psychological debriefing, the counseling and all that should commence. We should not wait. We should not just feel that, oh, now that we're able to accommodate them, now we're able to heal their wounds, the physical wounds, so they are okay. No.
Okay.
No. So the counseling centers should have counselors, should have clinical psychologists, okay, who help people to navigate through whatever their responses they're having now.
Okay, now what would be some of the effects of, excessive or prolonged grief?
Okay, well, I have mentioned some of them earlier, like if one is not able to undergo or navigate through those processes I talked about, then phobia may set in. Let's say phobia to travel now by air. So people will be afraid. I mean, the survivors now, so they find it difficult to go to airports and travel by air, even travel by road by some people. Okay, so phobia, anxiety disorders. Okay, after that, then depression, adjustment disorder. The person may find it difficult to adjust to life again. Okay, become withdrawn to self, withdrawn to his shell. Okay, then there's what we call the acute stress reaction or acute stress response. It is normal for some people, but for some other people it becomes a disorder because it now affects their functioning, their ability to cope thereafter. So acute stress reaction usually happens within the first 30 days of a traumatic event. The person finds it difficult to adjust, to come, to live a normal life again. The person is still brooding over the loss. This person is still having those somatic, bodily complaints, and then this sense of hopelessness, being dejected, these symptoms be coming. If these are not well taken care of, later on, after 30 days and beyond, what we call post-traumatic stress disorder will set in. So the person will begin to have intrusions, nightmares. The person tries to re-experience those traumatic events. And when those feelings come, it's like the traumatic event had just happened. So the person, the individual, find it difficult to live a normal life. And then maybe at the end of the whole thing, if care is not taken, the depression becomes severe, suicidal things, suicidal thoughts, okay, suicidal actions may come in.
Okay,
yeah.
And for some people dealing with grief, they resort to taking some drugs or alcohol, to dull their pains. What kind of help is there for such people?
That's abnormal reaction to traumatic events. Of course, that's like a shortcut, so to say, but it's not normal. It's not proper. A lot of people will be taking alcohol, be smoking, or be taking some sedatives in order to overcome or to forget those traumatic experiences, like intrusions, as I mentioned earlier. Well, maybe the first few days of such traumatic events, where there may be room for some sedatives, especially if the person is really taking it so serious, or want to enjoy himself or whatever, okay, or not actually sleeping. Well, there's a room for use of sedatives initially, not alcohol, not psychoactive substances, not smoking, okay. But by and large, we don't encourage the use of alcohol or sleeping pills. They are not good because those ones will cause additional problems of addiction. So the person becomes used to those sedatives, and that may be a kind of a gateway to the use of other substances thereafter. So we actually discourage people from the use of psychoactive substances because those ones have their own problems, big myriads of problems associated with that. So okay. The normal thing is for an individual passing through this situation to open up, not just bottling up the emotions to show that you are a Mako or that you have a strong heart, you can curtail everything. If you know you can't curtail, there are people you can talk to, maybe your religious leaders, okay, maybe friends, well-meaning friends, not those who, worsen the whole situation. Then you can reach out to clinical psychologists too, or health workers, especially mental health workers. In our center, Federal Neuropsychiatric Hospital, we have designated our community center, clinic. It's called Abbey Road Community Clinic. Okay, it's situated at 8 Abbey Road, Yaba. So people who have such needs, who have problems, they can come up. And they should not just feel that, that it means that they are mad or that they are really sick.
Yes, because there's this issue of stigma. Why should I be talking to a psychiatrist?
Yes.
Over issues like that, but it's not something to worry about. They should be able to come up and be
worried about. So people should feel free to come to our community Abbey Road Health Center, where we have counselors. It doesn't mean you have to use medication now that we are going to write prescription for you. You may not get to that level. In fact, that's what we are trying to prevent. Prevention, they say, is better than cure. So before you get to the stage that one begins to lose his mind or whatever, you can come now, give you a good forum, good setting that you can express yourself, and people who understand, specialists in this area, would counsel such people. And if it actually involves psychological treatment like psychotherapy, yes, that can be offered too.
Okay, let's just take a quick break, and when we come back, we'll be giving some of the numbers that the people can call to get help and counsel on whatever grief or loss they are experiencing right now. Just stay with us on Health Matters.
Our definition of news revolves around you.
It's all about events and issues that affect you.
There's simply no limit to issues and events.
Issues that will help you make important decisions and take actions.
And actions that could transform your life and the things around you.
Looking at all sides, we keep the story simple so you can understand it and make informed decisions.
It's really all about you.
That's what we do.
On Channels Television,
your home for the news.
You're watching Health Matters on Channels Television, and we've been talking about coping with grief and loss. You can join us in this discussion if you have any questions, if you have comments, or you want to ask the doctors any question. You can join us on 018923 again 018923 All right, but before we went on that break, we're talking about how people can come, for instance, to your center at the Federal Neuropsychiatric Hospital, to get help. But are there numbers, that the people can call? Because some people may not have, the opportunity of coming to your center.
All right, before I give out the number, let me clarify that when you are coming, that does not mean that you are going to register as a patient. No, it's different. You are not going to register as a patient, have a file, and, but you can ask for the Abbey Road Community Clinic.
Okay, not necessarily coming to the Federal Neuropsychiatric.
Not coming as a patient, no. That will scare a lot of people, of course. So you can come in to Abbey Road. It's close to our center too. Let me say within the compound, but not really the hospital per se. Okay, so you ask for Abbey Road Community Clinic. Then you get there. Let the staff there know the reason why you are there. Then, because we've made special provision for people like that now.
Okay.
Especially
particularly for this
yes,
event.
The recent event that happened. So they can also reach us on this number 0177431174. I repeat, 0177431174.
Okay.
So we can be called on.
So instead of coming, if you can come, you can call, and there are counselors ready to take this call.
Yes.
Okay. Now let's look into some other forms of loss. Sometimes we're talking about the loss and the plane crash.
The plane crash.
Some people were on ground, that were affected. Some, as you say, some people saw the magnitude of this and also be disturbed. What kind of help will be available for such too?
Yes, especially the ones we call the first responders.
Okay. Before you go on, I think we have a caller.
Okay.
Hello.
Good afternoon. Good afternoon, sir. Doctor.
Okay,
I'm calling from Ota.
So
my name is
for those who watched what happened, who observed that, who the first people that came there, that saw mangled bodies, that saw buildings set ablaze by the impact of what happened. Of course, we read in the paper yesterday, some were having the fear that maybe there will be so many ghosts, So some of the people they have even packed out of that locality, some will be afraid that, they may not be able to sleep here again in the nights. The ghost of those people that died would come over to that place. Well, we will not blame them. It's as a result of their cultural or religious beliefs. But for such people, yes, they can still reach out onto us. They can come to our center. And then we also have a counseling centers, I think in some designated places in Lasuth. And our team has been there a few days ago on Tuesday. The community outreach of our hospital has been there to counsel people. And by the grace of God, we'll still make ourselves available too, so that people in that locality can come to us. We can counsel them, can listen to their complaints, and see other ways we can help them thereafter.
Okay.
So people should not just keep quiet and feel that it's part of life.
Okay.
For some, they will be able to navigate through without any help. But for those who are not able to pass through this and who are still having problems, some complaints here and there, they should feel free to come. They should not allow stigma or those feelings, wrong notions to prevent them from coming to us.
Okay, and I said earlier that, there are no right or wrong ways to grieve. For how long? Is there a time frame for grieving also?
Yes, we expect that within the first few weeks. Sometimes for some people, it may linger on up to about 6 months. Even in some places, up to between 6 months and 1 year, because grieving has about 3 phases. The first phase, few days and few weeks. Okay, second phase of it, okay, that may happen, maybe up to 3 months. Then the third phase, 6 months, but definitely anything above 6 months,
okay,
or 1 year.
Okay, just hold your thought, please. We have a caller.
Hello, good morning.
Yeah, thank you for joining us. Could you turn down the volume of your TV set, please? Oh, we lost that call. Okay, so you were saying it shouldn't be more than 6 months, grieving.
But sometimes it may not even be up to 6 months. But if there's serious dysfunction in the life of that person, okay, maybe the person is unable to go to work, unable to now socialize with people, we don't have to wait for 6 months or 1 year. But what I'm trying to say is that some of those symptoms may still be there up to about 6 months, or even sometimes up to a year. The person still have those feelings, okay, about the departed soul, feels depressed, mildly depressed, okay, or worried, or have fond memories of the individual, when he was alive, okay, which we can still allow for that. But definitely over a year, and the person is affected, not able to bounce back to his or her real self, the person should not wait, should call for help.
Okay, yes. And the people around, as you say, if the grieving is, getting long, they may now turn and say, okay, is it only you? What is the role of those people around them, aside from you said that they should counsel them? If they've counseled and it seems like this person is not showing signs of, coming out of it, should they, the issue of trying to say, is it only you, and, saying things that could also, affect the individual?
Well, people should avoid, passing wrong comments to such people. How come that you are still undergoing this one? Be a man now. Get yourself over this one. We should not be judgmental, okay? We should rather show empathy, not even sympathy, empathy. Put ourselves in the shoe of that individual, okay? Feel touched by the loss, and express kind words, not demeaning words, not derogatory words, not comments that would further hamper or affect the heart of that individual. We should also know that the response of people to loss, grief, may vary from one individual to another. It's not the way A will express concern that B was so expressed. So we should make room for that. But by and large, we've now realized that this person, things are really going the other way around. Then we should not just wait. We should call for help. That calling for help may not necessarily be hospital immediately. Maybe call the religious leader, the pastors or the imams to help the people, elderly people within the family to talk to the person, the friends, the loved ones, take the person out, help the person to do some domestic works, or look for various ways we can help the person to come out of the present situation. But if all these are not really working, then we should not rule out the possibility of helping the person to see health official, especially mental health official.
All right. Just before we go, I'd like to, just remind our viewers that if you have any concerns as to, your relative or that is going through grief, you can call this number on 0177431174. That is 0177431174. Thank you so much for coming on the program today.
Thank you.
Thank you. And thank you all for watching at home. Do stay tuned now for News Track. I'm Yomi Otaigbe.